After hours of uncertainty and panic following the arrival of the student from Guangzhou, China, who is said to have exhibited symptoms similar to coronavirus, the Ministry of Health says the patient has been isolated. As samples collected from him will be subjected to more tests to rule out or confirm the virus that has so far seen a death toll that surpasses 100 and left about 4,500 infected in Wuhan province, China.
The traveller reported he had not been in contact with a known case of novel coronavirus 2019. And he was immediately isolated in a temporary holding room at the airport. He was later transferred to the infectious disease unit in Kenyatta National Hospital.
The outgoing Health Cabinet Secretary Sicily Kariuki says the patient, who was aboard a KQ-887 flight from Guangzhou, was found to be in stable condition, with all his vital signs said to be within normal ranges.
So far, this remains only a suspected case.
The government says it has heightened surveillance in all entry points of the country, adding that it has sent an alert through the national carrier KQ to other passengers who are aboard the same flight to report to the government should they say experience similar symptoms. And as a precautionary measure, the ministry advises that
the need to maintain basic hand and respiratory hygiene. 2, safe food practices need to be observed across the country. 3, avoid close contact with people suffering from acute respiratory infections.
They say the symptoms one should look out for include
fever, coughing, difficulties in breathing, sneezing with a history of recent travel to China.
Even as investigations to ascertain whether the patient has coronavirus or not continues, Kenyans can only hope that the government has put enough measures in place to deal with any eventuality. Gloria Milimu, K24 at Kenyatta National Hospital, Nairobi.